And I'd like to start out with possibly what in the nursing force can be done to improve the quality of patient care in Hawaii. And I would like to start off with employer-employee relationships. We would like to promote collaborative working relationship between all employers and employees. That's number one. And in doing so, it will improve the working conditions for nurses so we can put a stopgap on the nursing shortage, which continues today. We continue to have this nursing shortage, and let me tell you, the median age of a nurse today is 40-something. I won't say what, 40, high 40s. It used to be in the 30s. Now we're approaching the 50s. And in promoting employee-employer relationships, we need to recognize, all of us, that there is this symbiotic relationship, that each one thrives off of the other. And when we collaborate our efforts, then we can be more productive. We can hopefully retain the quality of patient care. And we would also take the necessary steps towards maintaining our experienced nurses in the workforce. And which brings me to the next point, the nursing shortage. What's going on with the nursing shortage at the moment? We are losing a large percentage of nurses to retirement, and the second reason that we lose nurses is to injury, musculoskeletal injuries. Nurses seem to have the highest percentage among workers of musculoskeletal injuries. And we currently have legislation. It's called the Safe Patient Handling Act, and it's at the state as well as the federal level. And the legislation suggests the use of mechanical devices. This is not just for nurse safety, it's also for patient safety. Mechanical devices to lift and move patients, because this is when musculoskeletal injuries occur. And so I would promote the support for the Safe Patient Handling Act, both at the state and federal level. And along those same lines, we also have legislation on prohibitions on mandatory overtime. Mandatory overtime sometimes is unavoidable due to the nursing shortage. When we don't have someone to replace a nurse, we simply don't have a choice. However, there are some safety issues along with mandatory overtime, like working longer than 14 hours, 16 hours, or some nurses even work up to 20 hours. So we also currently have legislation also at the state level as well as the national level for prohibitions on mandatory overtime, which I hope we can all support. And as far as coverage, expanding access to health care, we have a great need for nurse educators. We have a great need for nurses who are able to take the time to educate the public. It doesn't work when we bring in a patient, we treat them, and release them back home or wherever they came from, and not arming them with the necessary knowledge to help them care for themselves. We have a need for nurse educators, and we also support the expansion of prescriptive authority for APRNs, advanced practice registered nurses, as well as nurse practitioners, because we do recognize that we also have a shortfall when it comes to physicians on the islands. We are also losing physicians. We're losing physicians as well as nurses because part of the problem is the reimbursement process. We have the lowest reimbursement percentage in the nation at 37%, lower than the rest of the nation. That's from a few years back. I don't know if it may have climbed since then. I would also like to speak on another piece which is being promoted at the national level, which is Healthcare for America Now, to promote access to healthcare for all. And that is also being pushed through by several other organizations, not just nursing organizations, but we also have other labor organizations, faith-based organizations, and we actually have a rally in Washington, D.C. on June 25. One more issue I'd like to touch on is solvency. Solvency is actually, it belongs to both employer and employee, which is why we want to promote the relationship between both sides, because it is both sides' responsibilities to find means to maintain solvency. We don't want to see any more hospitals closing down or any more services being done away with because of financial constraints. So those are the basic points as to why we are continuing to promote collaborative working relationships. Thank you.